Good morning, everyone. This is supposed to be the last presentation, so just it's kind of rushing you through few case scenarios, and I would really like this to be interactive. All right. So I'm Fairooz. I'm from Bangalore. These are my affiliation currently in India and abroad. So orbital tumors, well, if you would have heard benign and malignant, you would have known that it's kind of a Pandora's box. Anything is possible in orbit. It can masquerade in various forms, benign, an inflammatory lesion like malignant lesion, a malignant lesion, vice versa as an inflammatory. Case number 1, all right? This is a 4-year-old child with bilateral retinoblastoma. This eye is well treated and stable. She had undergone enucleation in the left eye. She had high-risk features with scleral invasion in histopathological evaluation. She had received radiotherapy and adjuvant chemotherapy following that. Everything has been going fine. 9 months after the treatment, this is when the child was referred to me. She has severe copious discharge in the left eye. One day the father comes telling that the implant came out in his hand. So he actually had the PMMA implant in his hand, and then he came to me. I was scared. This is what I saw in the socket. All right, a reddish elevated nodular lesion sitting in the socket over there. Unfortunate. So my first diagnosis would be Sonal recurrence, right? Yeah, orbital recurrence. High-risk features, although the child received good amount of radiation dose and chemotherapy, but this is the situation. I was really scared. The next step was to get an imaging done. Implant is not there, all right? It has extruded. This is the customized ocular prosthesis which is sitting there. And can you see this large lesion? It's extending up to the apex. So any comment from the audience? We have Dr. Seema, Dr. Vikas, Dr. Anirban, who deals with a lot of RB cases. Sorry? No, I did biopsy. Okay. So the next step that I did was to biopsy that tiny little lesion over here, send it to Kaustubh for histopathology, like very, worried. And he said in the first instance, it's not RB. It's not RB. I was like, Kaustubh, you have to go and do the IHC. He did synaptophysin. It came negative. All right. Then I took this child for the granuloma excision. It came as granuloma, all right? Now you don't know why should a granuloma arise in a socket, which was masquerading as a recurrence, all right? I went inside, I excised. So the previous surgeon who did the enucleation in this RB child had wrapped the PMMA implant in a sclera, and the surgeon has put this Prolene sutures. That's how the sclera was sutured all around. So it was the scleral shell or the coat which was wrapping the PMMA implant, causing so much of granuloma, which actually scared us. In fact, the child is doing fine. So this is very interesting case. Yet another case, quite easy, bingo. Left eye, you can see hypertropia or dystopia. Okay, there was, you can see a kind of fullness over here in the inferior orbit, and this has been gradually growing in a 1-year-old child. Differential diagnosis? We'll go to the pediatrics and then jump to the adults. Child with a dystopia, abaxial proptosis, gradually progressing lesion. What would be the differential diagnosis be? A dermoid, yes. Yes. Quite an atypical location. I thought about a dermoid, but it's in the inferior. Let me take you to the radiological picture here. It's easy. So this is the large lesion, almost bigger than the size of the eyeball inferiorly. And you can see this multiple cystic. It's quite easy. There is a clue over here. This one, calcification. Cysticercosis? Well, it's a linear calcification. Can you see? It's kind of a linear calcification. Cysticercosis will be like dot-like calcification. Can I go ahead? All right. More closer. Multiple cystic, heterogeneous. It's not the same. Liquidy, more thicker. Calcification. Teratoma, yeah. So this was a case of teratoma. It was a large teratoma which was bigger than the size of the globe sitting in the inferior orbit. So you can see this was like the dermoid kind of the component, the fleshy component over here. And when I took it out, you can see this clear bone over there. So this is a case of teratoma. So these are the things that you need to look at into the orbital lesions of children, and he's doing perfectly fine. Yet another case, so he was 8 months old when he presented with this subtle proptosis in the right eye. All right, 8-month-old, subtle proptosis, gradually progressing. Axial proptosis. Easy again, axial proptosis. So it's in the intraconal space. Optic nerve? Optic nerve glioma, yeah. So this was a case of an optic nerve glioma, a large glioma almost extending up to the chiasm. So the current mode of management, I mean, although it will be covered, so is to give chemotherapy. So the child is still on chemotherapy. So we go even up to 12 months to 18 months of systemic chemotherapy in these children. Very interesting case again. Okay, so it bewildered all of us when she presented. So history of fall from the bed at night. She's like 11 months old, and this is how she presented. In fact, she was referred as a case of retrobulbar hemorrhage, okay, trauma. She fell down from the bed. So, well, we kept her on antibiotics. We started her on steroids also, all right? And this is how she presented later. In another 2 weeks, you know, there happened to be like an abscess forming over there. Very interesting. I went ahead doing an incision and drainage in this case, thinking that it would be an abscess. We did a CT scan in this case. I'm sorry I didn't put it up here. So there was this very diffuse, you know, haze in the orbit. There was no well-defined lesion, nothing, but nothing as a retrobulbar hemorrhage. You know, it was not, she didn't have proptosis either. So when I did an incision and curettage of this, incision and drainage of this pus over here, I went deep inside, there was pocket, and this is what I found. Trauma, lots of inflammation. The eyelid doesn't have ecchymosis, which is very typical in a trauma case, right? It was just kind of an inflamed eye. No ecchymosis, no hemorrhage, in fact, there, leading on to develop into an infection over here. And this is what I got. You can see a lot of hair. It was a dermoid. So it was a trauma. The child fell down. The dermoid ruptured, causing a lot of inflammation in this patient. All right, so dermoid is yet another orbital tumor that you can expect in a child. This is a child again, trivial history of trauma. Referred as a case of retrobulbar hemorrhage again from a pediatric center, eye care center. He was very pale and toxic and sick. But it doesn't look like an infection. He doesn't have fever. Do you think it's an orbital cellulitis? No. Ecchymosis there? Yeah. What would you want to do next? Okay. I did a CT scan, all right? Yeah. Okay. Almost there. And this is what I found. Okay, so we just did a peripheral blood smear. It was case of an acute myeloid leukemia, granulocytic sarcoma. An African male presenting with 6/36 vision in the left eye, grade 2 RAPD, optic disc edema. A large lesion, history of a biopsy done, which came out to be a benign lymphoproliferative lesion in Africa. But IHC was not done, and this is how it was. It's a typical case of lymphoma. So IHC is so very important. Even if you do a biopsy at your place and it comes out as a benign lymphoproliferative lesion, don't go with that diagnosis. Ask the pathologist for an IHC, and this is how it progressed, you know, to cause an RAPD. So it was a non-Hodgkin's lymphoma, EMZ, the extramarginal zone lymphoma, CD20 positive, and he's getting chemotherapy. Yet another very interesting case. This case was referred to me as a case of ptosis. Well, I couldn't buy that. This is the last case that I'm going to present. I couldn't really buy that it's a case of ptosis. Do you think it's a case of ptosis of right eye? Upper lid, yeah. There is in fact a kind of fullness over here, you know, yeah. So did a CT, and it was a small lesion sitting in the, you know, superomedial compartment of the orbit. I went ahead, so this is the superior oblique muscle over here. So this lesion was wrapping all around the superior oblique muscle. And surprisingly, it was a Tcell lymphoma, follicular helper phenotype. In fact, a PET scan showed diffuse lymph node involvement. Bone marrow was negative, so she was stage 3. And this is how she looks. She's happy after the systemic chemotherapy. Well, I'll stop here. Thank you.